Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting and from viewers like you.
Hello and welcome to Louisiana Public Square. I'm Beth Courtney, President of Louisiana Public Broadcasting. Moderating tonight's discussion on HIV and AIDS in Louisiana is LPB News anchor Andre Moreau. And what an important topic,
Yeah,
Andre.
boy, is it ever, Beth. Thank you. You know, 3 years ago, Louisiana Public Square explored this same topic, and unfortunately, not much has changed. Baton Rouge and New Orleans still remain in the top 3 cities for new HIV diagnoses. Gay and bisexual men still account for the majority of new diagnoses, and the rates among blacks remain disproportionately high. The number of black males living with HIV is 4 times that of white males. For black females, it's nearly 12 times that of white females.
Well, the news is not all bad, Andre. Louisiana has surpassed the CDC's national goals for HIV testing and decreasing late-stage diagnoses. 82% of people living with HIV are linked to care, and 71% of people with HIV have reduced the amount of virus in their blood to undetectable levels. But challenges still remain, particularly in Louisiana's rural areas. Tonight, we'll examine the many efforts taking place to tackle these diseases and a medicine called PrEP that could possibly end the HIV epidemic. First, an overview. A year after getting a blood transfusion in 1984, Monica Johnson received a letter saying the donor had died from acquired immune deficiency syndrome, the advanced stage of HIV. She was tested, but the results were inconclusive.
I was in college. I was like, well, you know what? This didn't apply to me anyway because I'm not white, I'm not gay, I'm not a man. So, and that's what they were saying, the modes of transmission, who was, transmitting the virus. And I'm like, oh, this don't apply to me.
When she became pregnant, her OBGYN ran another test. This one came back positive for HIV, and her son also was born with the disease. Word got out about her status in her rural community, and she was suddenly shunned.
I got fired from substituting. They didn't want me to work there because they didn't want me to be around their kids. If I went to the drugstore, they would disinfect the counter before I could walk out. If I was walking right downtown, people would cross the street so they wouldn't have to walk by me.
Monica became an advocate for her son, and following his death 3 years later, for herself and the many HIV-positive women she met. She founded HEROES, an acronym for Helping Everyone Receive Ongoing Effective Support. The group released a report this September highlighting HIV in 12 rural parishes of northeast Louisiana. The study notes more than 15% of people living with HIV reside in rural parts of the state. While there has been a 14% overall drop in Louisiana AIDS diagnoses, rural Louisiana saw a nearly 1% increase in these diagnoses.
Stigma, people test late, lack of education. So many people, they hear the words and they shut it down.
Dr. Deanne Gruber is the director of the Bureau of Infectious Diseases with Louisiana's Department of Health. She confirms the challenges for rural residents living with HIV, but notes that more recent data shows an improvement in AIDS diagnoses.
We saw in 2014 in this region, in this rural region of the state, that 34% of individuals had progressed to an AIDS diagnosis within 1 year. However, when we look at the next year in 2015, we saw that that had decreased to 27% of all individuals newly diagnosed had progressed to an AIDS diagnosis.
Louisiana currently ranks number 2 nationally for HIV rates. Baton Rouge and New Orleans rank 2nd and 3rd for new HIV diagnoses among major U.S. metropolitan areas.
On average, over the past 10 years, we have approximately anywhere between 1,125 and 1,150 individuals who are newly diagnosed in the state, and that has remained pretty steady.
The primary transmission for men in Louisiana continues to be man-to-man sexual contact at 80.2%. For women, heterosexual sexual relations at 88%. It's estimated that 18% of residents are HIV positive but don't know their status. To attack the disease, Gruber says the Department of Health sponsors over 100,000 free HIV tests around the state, incorporates testing into many routine emergency room visits, and links HIV-positive individuals with care through contracts with 7 community-based clinics.
And we also have linkage to care coordinators that if we identify somebody who has not seen a medical provider for at least 9 months, that linkage to care coordinator, and we have 10 of them located throughout the entire state, who then go and locate them and really help to assess what is going on that we can help get them into care.
The department also offers an online clearinghouse of information called LouisianaHealthHub.org. And the latest contract with the state's Medicaid managed care provider, Bayou Health, makes the suppression of the virus in HIV patients one of its performance measures.
We have the knowledge now and the scientific knowledge that U equal U, undetectable equal untransmittable.
Dr. Warif Azmeh is an infectious disease physician with the AIDS Healthcare Foundation in Baton Rouge. He says current HIV drugs can reduce the virus in a patient's blood to an undetectable level. An individual who is virally suppressed can't transmit the disease. The latest medical breakthrough, though, is a protocol that can prevent people from even contracting HIV.
PrEP stands for pre-exposure prophylaxis. Research has shown that pre-exposure prophylaxis with a medicine called Truvada, if somebody is HIV negative and take the PrEP on a daily basis, he does not contract HIV.
While PrEP services are offered in 15 locations surrounding Baton Rouge and New Orleans, there's only one PrEP provider and one public HIV healthcare clinic in Northeast Louisiana. Gruber says the Department of Health is trying to address these challenges.
It may take an hour and a half or more for somebody to be able to travel to an HIV clinic or a provider who can treat them. And we also, again, see, too, that stigma may be more prevalent in rural areas compared to in the metropolitan cities. And so, we keep a close eye on what is happening in those rural areas. We look at our resources, different interventions that we can do to try to address that.
Monica, who has experienced that stigma, now holds an annual camp for HIV-positive women to offer support and education. She cautions individuals not to become complacent about the disease.
In Louisiana, people think it's handled. It's not handled, and people need to know their status. The only way you know your status is to get tested.
Joining us in our studio to discuss HIV/AIDS in Louisiana are people from the greater Baton Rouge area. They include people from the field of healthcare, a drug company rep, and community members who use values education to combat the disease. We're also joined by members of the Legislative Youth Advisory Council. We want to welcome everyone. LSU's Public Policy Research Lab surveyed over 100 citizens on this topic in the past for us, and among the survey responses, when asked why they think Baton Rouge's AIDS rates are so high, the top 3 answers chosen were poor sex education at 38%, lack of access to quality health care 13%, and inadequate HIV testing 10%. Now, while Louisiana doesn't require sex education in public schools, when it is taught, it must be abstinence-centered. Of those surveyed, 61% support this approach, 30% oppose it, 9% refuse to answer or were unsure. Despite the significant support for current abstinence-only sex education, an even larger percentage of students, 72%, a more comprehensive approach to support a more comprehensive approach to the subject. 22%, though, oppose that. And when asked their concern about their friends or themselves being infected with the HIV virus, respondents were nearly evenly split. A total of 53% were somewhat or very concerned, while a total of 47% were not too or not at all concerned. So let's start right there. How concerned should people be about HIV and AIDS, and what can be done to bring the number of cases down? We're going to start with our studio audience, and Sylvia, let me begin with you. You work with a group called Gilead.
I do. I work, I'm here representing myself as a community member. I do not speak for the company itself, but I'm just really interested in learning how to support clinics and hospitals as they ramp up opt-out testing.
And so we all know the company does what?
Gilead.
It does what? What is
I'm
the maker?
sorry, it's a pharmaceutical company that provides HIV and hepatitis medication.
Got it. What about you, Shirley?
I think if we get the information and the about the U equals U, again, that's undetectable means equals untransmittable. Get the information about PrEP and PEP out, and we're going to have to do an effective job of getting that information out, like pounding the pavements and with the billboards, letting people know that there are now something we can do to not only prevent people from getting infected with this disease, but it also is something we can do to help a person that may think that he or she may have gotten exposed to the infection if they seek treatment within 72 hours. So the key is going to be really getting the information out, letting people know, getting them to understand where we're going to end this epidemic.
Well, getting the information out is certainly the duty of many groups. One group in town would be Heart of Baton Rouge, and Tim Young heads that up. So are you guys effectively getting the word out, for one thing, and how have you seen this progress and change in the several years that you've headed up this group in Baton Rouge?
It's changed quite a bit, Andre. I started with this organization 20 years ago, and people were just then receiving the drug cocktails that were helping them to get off their deathbeds. And we see now people going back to work, and our patients relatively don't go to the hospital anymore, because if they're on a medication that's effectively keeping their viral load down to an undetectable level, they don't really get sick. So they have the same lives they did before they became HIV. What we're not doing is we're not effectively getting the message out to the primary target group that we should be, men who have sex with men, and they need to take responsibility for their own behavior. Still, half of all of our new infections are among that group, and they need to protect themselves, their partners, particularly their female partners, and they can do that by the new PrEP protocol, pre-exposure prophylaxis. I can't say that often enough. One pill once a day of Truvada will prevent someone from acquiring HIV infection. So someone who is continuing to engage in risky behavior, then they're not left to take actions at the moment where they have to use a condom. They can have this biomedical intervention that is with them all the time. One pill once a day. It's a simple regimen, and it can protect them from unhealthy choices.
Adele Brown, I know you want to say something about this, and so I've got my finger pointed toward you, sir.
Thank you, sir. I think that the things that you're talking about are important, and it demonstrates progress. But I think the challenge, having been involved in this HIV/AIDS for over 30 years, starting out at a church, one of the first churches in Baton Rouge that would allow it to be in this church, I still find a lack of receptiveness when you go to the faith-based community, and we know we can't do it in the school. And what troubles me about this is that we still got too many young black males and young men of those young that don't fall into those sectors where you can easily get information to them. And so how we began to access that community to make certain that there's not just a risky behavior, but there are consequences to that risky behavior.
Yeah, for several years, Baton Rouge was #1 per capita. Now #2, New Orleans #3, Miami is #1 per capita.
Right.
But Jackson, Mississippi is, and Atlanta are 4 and 5. So it's really southern cities seem to be the higher per capita.
Right.
And the black rates disproportionately high.
One of the things that come to mind as part of this discussion, I think that there's a large number of African American women that are living with HIV and are newly diagnosed each year. There's been an emphasis on men who have sex with men, and I think that when you look at the number of women, African American women living with HIV, and the newly diagnosed women each year, there should be some emphasis that's geared towards African American women. And I think that should become an important population, and it's not one that is being addressed. The campaigns feature MSMs, but I don't understand why there is not more education for heterosexual African American women.
Question. Let me, I know we all say that everyone should be tested. So raise your hand if you've been tested. Everyone not been tested? Two people not been tested here, two of the younger people, of course. What about the stigma? There's several stigmas attached. And this goes hand in hand with, it can come with religion, it can come with your upbringing, your ethnicity, all sorts of things. What about that? How do we overcome that?
Yeah, I think about that stigma as well, because like I'm active in the community, but I also I'm involved in the work of the Urban Congress on African American males, and we deal with several things that are important to, we feel are important to African American males and changing their experience in Baton Rouge. And we have to have innovative ways of reaching these guys, because like you said, there's a stigma that's there. So even though we have the information for them, how do we create a better way to give them access to that information, to that education, and to, if not make it cool, at least make them more receptive of it? So do we put it in a standard commercial? Because it looks like a commercial. It looks like something that may not fit me. Do we give this a different face? Do we even though we put out stats of men having sex with men and the disproportionate rate of that, do we show also that heterosexual men have contracted this? And do we allow those men or embrace those men to advocate as much as we do gay men to prevent? Because the main thing is to prevent this as well.
If anybody remembers the 1980s, they remember the death sentence, the 1990s, the death sentence that AIDS was for so many. And that has changed with drugs, but there is still no cure yet, even though there's been a lot of money spent in funding. In 2017, Kim, should there be a stigma? Should we still be fighting a stigma?
Well, I think it really goes to the question you asked at the beginning, which is this something we should be worried about? I think we have to move beyond, is this something I personally need to be worried about? And certainly that personal responsibility is part of it, but is this something our whole community needs to be worried about? This, to Sharon's point and AV's point, the intervention that ultimately takes us forward to the next step in eradicating HIV is going to be one that looks at everyone who's at risk. And
Absolutely.
the whole community is at risk.
We can't say, it's not me, it's not my problem. It needs to be all inclusive, everybody. What about some of the younger folks?
Well, I know, like you were speaking on the urban community, well, I know that it's very hard for, no matter really what race you are, that it's just hard to, come out and say that, because you get like criticized or different things because you have this disease. And the one pill, like you were saying, it is very important, but I also think that it's very hard for people to come out and like just go walk in the store and be like, hey, let me get this. So again, like you were saying, like I think the way to get it out would be each race helping each race out. Like I don't think it just should be focused on just the black community or focused on just the white community or whatever ethnicity you are. I just think it's, like you said, a community thing that needs to be put in effective to get the word out and things like that.
Well, skin color is obviously not involved in this. It hits everybody. I think it's people helping people, embracing people. That's one place we could start. We should have been there a long time. That is all the time we have for this portion of our show. But when we come back, we're going to be joined by a panel of experts to further explore HIV/AIDS in Louisiana. Welcome back, everyone, to Louisiana Public Square. Tonight, we're discussing HIV and AIDS in Louisiana. And joining us now is our panel of experts. Dr. Tavel Kendall is a board-certified family nurse practitioner with the Greater Ouachita Coalition, providing AIDS resources and education, or GoCare. It's based in West Monroe. GoCare offers primary and specialty care to adults living with HIV/AIDS in 12 parishes in Northeast Louisiana. Jamar Ennis is the executive director of the Louisiana Youth for Excellence, or LIFE. It's within the Office of the Governor. LIFE is a statewide positive youth development program that teaches, among other things, the consequences of at-risk behaviors. LIFE provides abstinence-centric resources to schools and faith and community-based organizations. Dr. Lauren Ritchie is a member of the faculty of the Department of Internal Medicine at the LSU Health Sciences Center in New Orleans. Board certified in internal medicine and infectious diseases, Dr. Ritchie's research focuses on factors affecting linkage and retention in care for people with HIV. And Eugene Collins is the director of prevention at the HIV/AIDS Alliance for Region 2 in the Baton Rouge area, or HART, that's in the Baton Rouge metro area. An assistant pastor, Collins is also co-host of Positive Voices. It's a radio program about HIV in Baton Rouge. We have a radio program about that. You didn't know that, did you? Before we go to our audience questions now, I want to ask each of you to briefly tell us, from your perspective, how optimistic are you that Louisiana's rates for HIV/AIDS will improve over the next 3 years? I'll begin with you.
Well, I mean, that's a very loaded question, right?
Absolutely.
And when I think about that, you got to think about that in a few different perspectives. Because the first thing we know, in order to get people into treatment and to get this community viral load reduced, we got to test more people. And when you test more people for this virus, guess what you're going to initially find? More of the virus. So as you find more of the virus, for the first few initial years, it may show an actual uptick. But as you get those people in the care, you get them on their treatment regimens, and you make sure that they stay engaged in care, and then you talk to their partners, and you get their negative partners on PrEP. After a while, you see a decrease. But initially, you might actually see an uptick if you're running effective testing programs.
Eugene Collins, thank you very much. Right. Dr. Lauren Ritchie.
I'd like to be optimistic, but I don't think we'll see those benefits in the next 3 years for a lot of the same reasons that Eugene said. As we do more testing, we'll find more positives, but also a lot of the things that we're doing to sort of link people to care and retain them in care, those benefits are going to take several years before we see changes in HIV rates, because we have to get people in care, get them undetectable, and that will avert future infections. So I'm more hopeful for 5 to 10 years than I am for 3, but still optimistic that we can do it if we put the effort in.
Thank you. Jamar Ennis?
We're optimistic that change is on the horizon. The Office of the Governor has bolstered its positive youth development initiatives to target youth in schools, churches, faith-based organizations, community-based organizations with a few things. We have a grant initiative that's going on to target our parishes in rural areas, as well as all the other 64 parishes statewide. We're bolstering our efforts for schools, building relationships with our educators, our superintendents, and our faith-based communities, our pastors and our community leaders in the church. So as our efforts increase, our education initiatives will increase, and our youth will be learning more about how HIV is contracted and the other STIs that are out there, as well as the consequences of unplanned teen pregnancy.
Dr. Tavell Kendall.
So I'm very optimistic, but I do have some concerns, particularly in our rural areas in the state. As you're aware, I'm in one of the providers in one of our rural areas, and so I really do believe that there's a lot of undiagnosed HIV in those areas. And so while we'll have a lot of efforts towards the larger metropolitan areas, I still think that there's going to be a gap and there's going to be some concern there. So moving forward, while I hope and I am very optimistic about us getting control of this, I do have some concerns about what's going on in our rural areas.
Obviously, these diseases affect a wide range of people across the state of Louisiana, and that's why I am very firm in my belief that all schools in the state that receive taxpayer allocations should be teaching sexual education. And a lot of parents are concerned that that people aren't getting the adequate knowledge that supposed to be receiving, and that they're only hearing that just abstinent-based results. And so I'm of the belief that teachers should be pushing more just general education that should be out there in the public, like how to put on a condom, where to buy a condom, some of the general stuff that goes along with sex in general. And so my question goes to, should school districts allow parents to serve as a heckler's veto of sorts?
Well, first off, I tell you, Joseph, I love that term, heckler's veto. I'm going to definitely have to use that. But, you know, and Joseph, I totally agree with you. When we look at comprehensive sex ed, right, and we know for a fact that Representative Pat Smith tried her hardest to push comprehensive sex ed for a very long time with very little traction. When we think about our youth, we got to think realistically, right? We know that everybody's not going to abstain, and there's so many challenges out there today that y'all face that my generation didn't face, or Ms. Shirley's or Mr. Tim's generation didn't face. That it's a much more difficult kind of environment for y'all, but it almost seems as if y'all are getting less information, and you're getting just one kind of track of information. And I always think about this in these terms. When I get up in the morning, I live in South Louisiana, I'm gonna make sure that my umbrella's in the car, right? Just in case it rains. I don't plan on it raining, but I wanna have it just in case it rains. Condoms are the same way. I don't want you to use the condoms, but if you decide to have sex, I want you to have them with you. And we gotta open up this conversation and just be real about it. Just have a realistic conversation and start to, implement these trends in schools. Because one of the things we don't understand, even though there's a statewide law that mandates abstinence-based programs, each district has the ability to do its own thing. And we need to educate ourselves more on that and start to push these things through those networks and increase the hecklers on both sides.
DeBar, you are in the schools with your program, so you are reaching out and speaking to them.
Yeah, absolutely. And Joseph, I'm very glad you brought that question up. And this is a great concern of the governor, to educate our youth in ways that haven't been done before. So we have a new curriculum that's not only engaging, but it's fun for our youth to participate in. And that they're not looked at as students, but more participants. So they engage in the material and they learn about the healthy choices. They learn about goal setting, decision making, and how to become a better leader. So our material it's new, it's up to date, and that's our job, to make sure that the best materials are in the hands of our students, our educators, and our school systems. So we sit down with all of our superintendents and get approval. We show them what the curriculum is about. It's not about popping in a tape with us. We sit down, we train our teachers, our educators, and we do it with fidelity so that they're qualified and that they have the material to answer all the tough questions, because our teachers are there for a reason. We believe that our teachers are still relied upon for students to use for guidance when they have questions. So we want to prepare them to handle those tough questions and understand the elements of reproductive health, the consequences of unplanned teen pregnancy, and the other STIs that are out there. So our youth can make the best decisions the first time.
Megan, you had a question that you wanted to ask.
Yes, it's very similar to engaging the youth. With 20% of new HIV infection rates being young people, what are we doing to get the information out there and ensure access to PrEP?
With a lot of the dialogue that we've already had, it is very, very important that at some point the state has some sort of robust, formal program that is really, truly moving in our educational system. It's very unfortunate when you get an adolescent that's newly infected, say 17, 18, 19 years old, and they have advanced disease. So what that means is it is likely that they've had it for quite some time. And the other thing that means too is that they've been having sex much sooner than people realize. And I think that's the most unfortunate thing that I see in my clinic. And I know there are providers who care for people throughout the state, but in where I'm located, and particularly Northeast Louisiana, I have several cases that are like that. And it's heartbreaking, but at the end of the day, it almost seems as though it's just one of those things that's just not really seen, so it's just kind of like out of sight, out of mind. But we really, really, truly need to do something about that. I'm a big advocate for PrEP. I'm a PrEP provider, and I have quite a few individuals who are on PrEP right now. Not a lot of adolescents, because it's still there's that issue with them getting permission or needing permission or not wanting to come because they're afraid or worried about what their parents may say, or something showing up on their parents' insurance. That's an issue, that's a barrier as well. But I think that as we move forward with regard to education, then certainly pre-exposure prophylaxis as well as post-exposure prophylaxis truly needs to be a part of that conversation.
I'm sorry, I just wanted to make mention of, at Hardin Open Healthcare Clinic, we've taken some active steps here in Baton Rouge to reach that younger generation around PrEP and PEP as well. We had a youth summit a couple years back where we brought Big Frida into town, and we had about 800 young people there, and we educated on PrEP that whole time, and they educated me on what PrEP and what twerking really looked like. And then we followed that up, and we done an effort with A.V. Mitchell, that's in the audience today. He put together a rap video just addressing PrEP and PEP, and we saw an increase in young people coming in for PrEP and PEP from that rap video. So maybe it's looking at some out of the box type of efforts that we don't commonly use in this practice.
Now, Truvada, PrEP was an HIV drug since 2004, and then in 2012 it was discovered, hey, this is a preventative, and so that's what we're talking about here. Doctor, what insurances cover it, and what are you finding in New Orleans with PrEP?
Well, that's always the challenge. It depends on the person's insurance whether or not you can get PrEP, although there are avenues now to get PrEP for uninsured patients in New Orleans. There's a lot of advertising in New Orleans right now. I just saw it on a bus that drove by today when I was on my way to work. But really what I think for PrEP to be more mainstream and to get to the youth, I think PrEP needs to be in primary care. So youth are seeing their family doctors, their pediatricians. Most of them don't think to come to an infectious disease clinic. Most people don't actually think they're at risk even when they are. So I really would like to see more knowledge in primary care providers and the option for youth to get this medication closer to home with somebody they already know and trust.
As a nurse and working in public health, I find we do encounter some patients that have some very outdated ideas and information still regarding HIV and AIDS. So I was just curious as to what you guys are still finding are the most prevalent misconceptions regarding transmission and treatment.
So you would think that in 2017 that we would have a pretty good grasp on HIV transmission, but I can assure you that that is not the case. We're seeing situations where people still believe that HIV is transmitted just by touching and kissing and different things like that. I had a recent scenario where a young man who was diagnosed, his family members threw all of his things out of the house because they were worried that he was going to infect them in some way. I think it's unfortunate. It's really unfortunate that there are still a lot of misinformation that's out there, and certainly the internet is not helping that because there's still a lot of dated stuff that's on there as well. And so they go to the online and they look up all this information. And I always share with, especially the ones who are newly diagnosed, to just be very careful about where you go and what information you're reading, because some of the information will make you believe that you're going to be dead tomorrow. So. But there definitely needs to be an emphasis because I spent a lot of time educating and reassuring them when we first start on that journey towards viral suppression.
I want to go to Jacqueline. We'll get to you just one second. Jacqueline, you had a question.
I did. It's very obvious that there is more of a problem in the Deep South and in rural communities. So I'm wondering why has the CDC cut funding by at least 20% for the southern states per person living with the diseases, knowing that there is, the widespread need for resources and for treatment in the Deep South.
That I can't explain what the CDC is doing. Sorry, but I mean, their data certainly shows that the epidemic is centered in the South, in the Deep South in particular, fueled by a lot of different factors. But we need all the money we can get right now and all the resources we can. In response to the other question that was just asked, you know, I think the misconceptions still are that HIV is something you're going to die from. Everybody that's newly diagnosed tells me that, you know, that they'll drop out of college, they'll think their life is over. When I try to explain to them that they're going to live just as long as everybody else if they take their medicine, it's like a light bulb goes off. It's a total transformation. Also, there's still this misconception about the medicines, that they're horrible and have a lot of side effects, which has changed a lot. Yeah, so I think those are the two things. And I'm sorry I don't know the answer to the CDC question, if anyone else knows.
One thing that we're finding is that the education and the public service announcements seem to be lacking. There have been many of them, but they seem to be lacking. So I want to ask both the doctors here, what would the perfect commercial look like if you had a commercial that would teach the truth about HIV? How would you write that?
I would first start off at least acknowledging the fact that it's not a death sentence, and to try to figure out some sort of message in that commercial that reduces stigma. Stigma, I really do believe that stigma is one of the reasons why we're still seeing so many people dying. I mean, there's probably someone right now who is just laying on the couch just wasting away, and they're just so afraid, so embarrassed, you know, to come into care because they're worried about what people are going to say. They're worried about all these different things. And so certainly those are the two things that I would like to see in the commercial, is just making sure that people understand that, you know, those days are over, you know, in terms of people dying and all of that stuff. Those days are over. And certainly, you know, just, you know, realize that, you know, you can live, you can be very healthy. You know, there's the new push right now with the science that's showing that undetectable equals untransmittable. You know, people just need to be aware that if they get on antiretroviral therapy, they will be healthy, they will stay virally suppressed, and they won't be transmitting and causing new cases.
All right, Jeremy, you wrote a very well thought out question. I'm sure you have several questions, but why don't you ask the panelists the question that you have?
Yeah, definitely. It's undeniable that the rates of HIV and AIDS are high in the low-income rural area of the state. But I'm curious if after-school or mentoring programs have some kind of impact on that. Our goal is to mainly educate and to help our youth make better decisions. So I'm just kind of curious if there's any research that's been done on how that's impacted the youth. And
Jamar?
We believe as an administration under the governor's office that that youth mentorship programs and after-school programs, adult programs, supervised programs are very effective in helping our youth provide them guidance to make them well-reasoned, more responsible, and help them make better decisions in regard to their health. So therefore, we've invested a lot of our energy, a lot of our resources to those community-based organizations, such as yours, to provide an extra hand, especially in the rural parishes that don't necessarily get those funds to do things with the youth, and we only supplement that with the best and the most accurate information that's medically accurate, that's totally inclusive, and that's age appropriate, and that's generally restrictive of any kind of biases that may prevent any child left out from receiving the proper education. So we love the mentorship, and we will continue to support those type of programs and initiatives moving forward.
I want to say that we had the idea of PSAs. Well, I just want to make clear that probably won't help the youth very much, because they're going to see either an ad on Twitter, they're just going to scroll on past it, or they're going to see a commercial about it and they're just going to tune out. And so I think it's got to go back to, like you said, into a small classroom environment where there are frank and open discussions about sexual education and reproductive health. And so I think that's something that needs to be
Absolutely, Joseph. And we train our teachers, our educators to create a judgment-free zone. So our youth are able to express, articulate their concerns, any questions that they may have in a judgment-free zone, so that they can adequately get their concerns addressed, any questions that they may have, in a way that's intelligent and responsible and educated. So this bolsters standing with our teachers to provide the correct information, but also the students and our youth are receiving what they need to receive in terms to make their, on their pursuit to be well-reasoned adults.
I think any place you need to go to reach somebody, no matter where that is, then you do that. And that's taking responsibility, all of us, which you addressed just a little while ago. Kim, you have a question for the panelists?
My original question was about the funding. If the CDC is going to cut funding in the Deep South where the epidemic really resides now, what can the state of Louisiana do? We have no line item in our budget for HIV. We never have. All of the dollars that are being spent by the most wonderful health department. We have such commitment from Dr. Gruber. We have such commitment from our partners at the state and the local level. But they are hamstrung by the amount of funding. The funding is not following the epidemic. What can the state of Louisiana do, whether it's a line item in the budget? Because we know what interventions work. We can look at evidence-based interventions. We know what to do. We know what zip codes we need to be in. How do we get the money to follow the work?
And you know, Kim, for years, the state would have a $2.5 million match to supplement the prevention monies that they got from the CDC. And we saw in the General's administration that $2.5 million match went away. And the state, and I don't mean the state, the programs or the programmatic side of it, but our legislators, they have to make a real conscious effort to putting a line item back in our general budget to address HIV. Because you, Ms. Nash, you brought up the question about the CDC funds and it being cut. I don't think those CDC funds come back. So I think the state has to just speak in real terms and start to address this locally, knowing that those federal dollars just won't ever reappear.
And the social determinants that help drive the HIV epidemic, those are also things that are woefully underfunded in our state budget. So education, health care, access to health care, those kinds of things that are also not being met in the state general fund are things I think we have to pay a lot of attention to. I'm just curious whether, I know it's a difficult time in the state from a budget perspective, but.
Well, I could tell you our governor has done his part, and since he's been elected, he has taken a priority to make sure that the expansion of Medicaid has been rolled out, priority number one. So that increases resources for everyone, for education and to bring more awareness so that individuals get what they need. So I can't articulate why the CDC has cut those funds, but I can tell you our administration is listening and we're well aware of those concerns. So, and as Eugene said, it does fall out on the legislators to hear it. So we encourage you to meet with them, share the ideas that education is important and create all awareness for not only for youth, but for everyone, the parents, the churches, schools, and our community-based organizations.
I would be a little worried about the line item legislation because there's a large movement in the legislature that's growing to try and get that out of the Constitution, and so I don't think that would necessarily be the answer. But I think it would just be a simple sentence in a bill that would try and get school boards, at least for youth, try and get school boards to mandate sexual education.
But even with schools, you think about the graduation rate that we have. So how many of these kids are actually in school to learn this? And then how many of the kids are actually being effectively taught what they're being taught currently? So we have to be more innovative because this is a crisis. If we already had best practices at hand, then we wouldn't have a crisis. So we have to go outside of the schools, even outside of the churches to some extent. One main reason why the rap song that was done with Hart, the reason why that song worked is because it spoke a universal language that went in schools, it was at the church, it was at the red light, it was at the barbershop, it was everywhere. And it destigmatized for a moment the AIDS and HIV, and it made people ask, what's PrEP? What is PEP? So even if we bring this into schools, think about how uncomfortable these kids will still be in the atmosphere where they're being bullied about things already. So now I have to talk about HIV and actually show interest. So this guy next door to me, or sitting next to me, would think that I'm showing interest for some other reason, you know. So we can reach them, but I believe even if we just aim straight at the schools, we're still missing the mark, because it's so much broader than that. So we just need to be innovative in whatever approaches that we take, and try things that we haven't tried before.
Leave no stone unturned. What
you
about the
go.
role of the church?
I think,
How could they be teaching?
I think that
I'm going to ask you that in a second.
Yeah, I think
Go
what I
ahead.
want to deal with the church and everything, because I think what I hear happening is that we begin to splinter between preventive and dealing with the initial phase of being diagnosed with it and then cure for it. And to some degree, all those got to fit into the picture. And to the degree that we began, somebody talked about adolescent, to the degree that we began to talk about adolescent and moving it began as a comprehensive way in an educational program that can be done in the school, I think it would be relevant. To the church, I think that goes back to your issue. How do we begin to create an environment that is not stigmatized, and that the church now appreciate it as being just one of their parishioners, and that it can hit any one of their parishioners, not an isolated or particular sector of the church community. And so I think that awareness program has to work out so it becomes acceptable to the church community, it becomes acceptable in the school community, and that we can also talk about it in the home. The other thing, very quickly, back to your issue, is that children and young folks, as I talk to them and work with them often, they still getting their sex education for their old uncle. And he's drunk when he's talking to them. He's telling them stuff that I haven't heard in 40 years. And so we've got to recognize that this awareness is about what happens and how it behaves, including HIV/AIDS, is maybe as old folky as whatever out there. And so we've got a lot of work to do.
One thing I'm hearing is the stigma, of course, remains, and HIV is whispered, like you would say, she has cancer when you talk to somebody. So it's there's an edge of uncomfortability about it. Dr. Ritchie, that must be frustrating with the funding. You see the patients, and sometimes you're in a catch-22, it seems like.
Yeah, we're struggling to provide the best care we can, but we know that in order to really curb the epidemic, we need to diagnose everybody and get everybody in care. And to the point, obviously I'm not a school teacher, but I feel like when we focus our sexual education on abstinence, we're missing a lot of opportunity to teach our kids the important things that they need to know. I mean, we teach our kids how to exercise so they don't get heart disease when they're 50, but somehow we expect them to be abstinent over a lifetime. It's extremely unlikely. So kids need to know the basics of reproduction, and people come to clinic with diagnoses that they had no idea that they were at risk for, and that's, I would rather somebody be educated and make a decision that maybe has a bad outcome versus just do something and end up with that outcome without having any choice about it.
All right, let's go to another question for
I
you.
have a comment in reference to stigma. What I find very interesting is that people who work with HIV and AIDS, whether if you're doing prevention or education, the community sort of stigmatize you as an individual.
Absolutely.
And I just find it so interesting that people will actually assume automatically that I'm HIV positive because I'm so committed to this work. And so I've had people to just say, well, when were you diagnosed with HIV? And just to make that.
Because you care.
Because I'm involved and I care. And so I think that when we have more people to become involved that are not HIV positive, that it's going to reduce the stigma.
Dr. Kendall, I want to ask you, you're in an interesting position because, of course, the larger cities continue to lead the nation per capita, but there is a decreasing of the number of cases. That's not the case in the rural areas where the epidemic is increasing.
That is true. And so it's really interesting. And I've been at my clinic now about 2 years, and so we have grown by leaps and bounds. It's a good thing and a bad thing.
You cover 12 parishes.
Correct.
Wow.
And so it's a good thing in that people now, they have a place where they can come. If they're newly diagnosed or if they're treatment experienced and they need a place to come, they can come. But it's also bad in that it's like, wow, you're still getting all these new diagnoses, and we get new referrals every day. Honestly, we do, from in some kind of way. We do testing daily during our regular office hours, so we may have someone who walks in and they test positive on that day, but it's awesome in that they're directly linked right there at that time to care, so we can move forward with that. I can't share enough how grateful I am to be in a state where Medicaid has been expanded, because people have access to care. We very fortunate with our staff that we have someone who, that's what she does, is that she helps to navigate that process for them so that they can get coverage and they can get the things that they need so that they can afford antiretroviral therapy and they can become virally suppressed. I am very afraid of what may happen, particularly because I'm in the rural area, that if for some reason we don't have Medicaid anymore, or for some reason some political agenda makes that be a barrier, what's going to really happen. And so while I want to be optimistic about the 3-year thing, and hopefully we'll get some ground moving, if we lose what we currently have, we're going to be in big trouble.
Tim, you wanted to say something, but we have just moments here. I want to get closing comments from everybody.
So on CDC, we have to do a better job. Those funds are highly competitive, and we compete against major cities like New Orleans. New Orleans has several direct funded CDC prevention programs. Baton Rouge has 0. And then HIV is highly preventable. It's not like cancer or heart disease where it takes a long time. It's very specific. It's through your own behavior. And if you're making bad choices, then you should be on PrEP. 1 pill once a day of Truvada will prevent HIV infection, protect yourself biomedically.
It's pretty simple. Eugene, some closing comments now.
And Dr. Adel mentioned it earlier when he talked about, we are still educating from the wrong point, from the old uncle, as Dr. Adel called it. But I'm going to take it a step farther. We still having the birds and bees conversation with kids when we know for a fact we're dealing with rats and roaches. Mm-hmm. We got to keep it real. You know what I'm saying? We gotta throw all the crap out the window and say this is what it is. Right. And we use that term regular people. And Ms. Meta Smith Davis is teaching me a lot about my language. Mm-hmm. When it comes to stigmatizing language, we gotta be careful with how we use it. And that term, and I do it too. We say, well, regular people. What is regular? Like, that's defined across the board. So it doesn't matter who's leading the movement. It needs to be normal. And having those conversations about the rats and the roaches at the kitchen table with your kids normalizes HIV. We need to get it back normal.
Dr. Ritchie, final thought?
I'd just like to tell everyone out there that doesn't know their status that they should get a test, and there's some information on the website about where to get tested, as well as anybody out there that knows they have HIV and is not in care. I encourage you to come in and get on therapy. So, thank you.
Jamar Ennis, brief final thought?
Okay. We as a community need to just come together and work together, because we're all trying to reach the same goal, and that's to lower the rates of HIV in our state. Our department focuses on youth aged 12 to 19. We have some interesting grants that are going on right now with the art. We have a request for applications on our website. You could visit us at gov.louisiana.gov and click on the Life tab. And we have different opportunities for parental involvement, for our abstinence-centric education. And we talk about abstinence, and we define it broadly as the refraining from doing anything that will impair a decision or something that will cause an unintended or unwanted outcome.
I believe that what we currently have in our arsenal, that we can truly control HIV. I believe with post-exposure prophylaxis and pre-exposure prophylaxis on this end, keeping people from getting it in the first place, we have the science that shows that it works. We have the tools. We have the resources. We just need to get it to the right people so that we can prevent HIV infections. And then on this arm with treatment as prevention, we do a really good job with viral suppression. We just got to get everyone identified and on therapy so that they can be undetectable and not cause any new cases. But ultimately, when we talk about prevention, because treatment, we can do that, but prevention, we've got to get the primary care providers to prescribe PrEP and PEP. They have got to do this. Stigma keeps people from coming to the places to get PrEP and PEP. They should not have to come to the HIV clinic to get this stuff. They really need to be able to go to their primary care provider, their PA, their nurse practitioner, whoever it is that they're seeing. I strongly encourage primary care, please do this. Please,
and
please,
stigma
please.
can make people sick.
Yes.
I liken you to a saint, the work you're doing, by the way, all of you. We want to thank our panelists so much for being here. Dr. Kendall, Mr. Ennis, Dr. Ritchie, and Mr. Collins for their insight on this month's topic. When we come back, we'll have some closing comments. We want to thank you so much for joining us tonight. Thank everyone for being here. We encourage you to visit our website at lpb.org/public square for additional resources about HIV. And while you're there, comment on tonight's program. We would love to hear from you. And join us next month as Louisiana Public Square explores some of the challenges the state's hunters and anglers are facing on Louisiana Sportsman's Paradise or Problem. Thanks for watching tonight, and good evening.
For a copy of this program, call 1-800-973-7246 or go online to www.lpb.org.
Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting and from viewers like you.